Ashley, lovely to see you again, and we're here today just to have a conversation about vaccines, particularly their importance as we go into autumn, winter. So as you know, Ashley, Alex Holloway, and I'm working on the COVID programme for North East North Cumbria ICB and collaborating with screening and immunisation colleagues. And I know we've worked together right at the start, but Ashley, would you like to introduce yourself?
I'm Ashley Price. I'm a consultant in infectious diseases and have been involved in vaccines throughout my career. You know, in terms of the hospital and vaccination programs here, I was at one point the Director of Infection Prevention and Control here, so that was an important part of what I was doing. And then clearly during the COVID pandemic we met, and there was a lot of important work that we did, driven by yourself, I think, in the team, and it was a very interesting time.
It certainly was, and it still is interesting and important. Yeah. So every year we have a flu campaign, but why is that?
Yeah, so the flu virus, which is influenza, and that's what causes the flu, is a virus that changes every year. From year to year, if you had it the year before, you have some immunity the next year, but it's not full. And that change in the surface proteins means that you're just not immune year to year. And what that also means is that the circulating virus is different each year. So each year a vaccine has to be designed that will be most effective against the virus that is now going to be circulating. It's a complex process, actually. The scientific community look at what's happening in the southern hemisphere, what happened last year, and it's a bit of a prediction as to what would be the best vaccine to give the next year. The other thing to say, and we may come back to this, is that even if you get flu when you have been vaccinated, and that can happen, it's likely to be less severe and you're less likely to transmit it to people, and there's good evidence for that.
Eligibility for flu within North East North Cumbria was quite a large population, approximately 1.6 million people, but specifically frontline healthcare workers are eligible to have the flu vaccine. What would you tell your team, colleagues across Newcastle, across all of our hospitals in the North East and North Cumbria as to why it's so important to get it?
So I think first and foremost it protects you against influenza, against the flu. We know that people if you're frontline, you're more likely to be exposed to influenza. So you're less likely to get ill, and that means you can work, you can feel healthy through the year. So that's very important, and actually a lot of us have vulnerable family members, over Christmas and so on, at other times of the year, and we're less likely to transmit influenza to those people that we love. And I think the other aspect to this is it's really important in protecting the whole workforce, but also then protecting the people we're looking after. Mm-hmm. And I think unfortunately every year we do get outbreaks of influenza in amongst vulnerable people, either on care of the elderly wards or transplant wards or neonatal wards. And occasionally that can really be devastating. Mm-hmm. Quite a few people can die during those outbreaks. We know that protecting the workforce can help reduce those hospital infections. I'm not saying that every hospital infection is because people haven't been vaccinated at all, but there is just a reduction, and it's just part of the ability to it's one of our tools in infection control to reduce infections.
Absolutely, and the NHS sees more people over winter as well, so that's probably another reason as well.
Absolutely, and I think that we know that when we have a really bad flu season, that less people come to work at the worst time. That we're really struggling already with numbers of patients coming in. If we've got a lot of people off ill, it can make the situation much worse as well.
Just wanting to unlock some of that importance from a hospital perspective. So we know flu is important, both to have it for the general population, for the staff, but also how does it link in with easing to some degree of winter pressures for trusts specifically?
Yeah, so I think there's a broader aspect to that, influenza vaccination into a population will reduce infection. And we know that by immunising young people, very young people, and the elderly, that we see it's estimated to be about 100,000 less admissions because of the immunisation programme across the UK. So that's a massive reduction in the burden of admissions.
Mm-hmm.
And some of those people will only be in for a day or maybe even just a few hours because they're ill. But some, get very sick, and we certainly every year on my wards we see patients who are in for weeks because of having influenza, and then they get secondary complications, and some people of course do die. Yeah.
And I think it's those secondary complications that leads to that kind of one patient, one bed, but then several days, several weeks within hospitals. So I think for some people, the memory of the pandemic is kind of forgotten now. We've moved on. There's more things going on in terms of people's lives at the minute. But one thing that was discussed was, or certainly a topic that some people think or have an interest in is the safety of the COVID vaccine. Because at the time it was rolled out to the general population quite quickly in terms of vaccine development. So I just wondered whether you could touch on why COVID was different and how we managed to get that vaccine out into an immunisation programme and the continued monitoring of its safety.
Absolutely. So I think you're absolutely right. It was done very quickly, and I think some people kind of potentially confused that quickness for a lack of quality in terms of us getting the data that it was safe. I was involved in a number of those vaccine studies, and we ran them here in our hospital. The reason they could be done so quickly was we were in the middle of a pandemic, and it was made a public health priority. So a lot of other research stopped. There was little other research happening. There was an immense focus on getting the vaccine developed, and that was from all aspects, from industry through to us as sort of frontline researchers. And that meant that we could recruit lots of patients into the studies very quickly, and there was an appetite clearly from the general public as well to be involved in the studies as well. So one of the studies had 20,000 people, but just well over 20,000 people, and that was what we call a placebo-controlled study. It's probably one of the quickest studies to recruit to a placebo-controlled study to that number. So when I say placebo control, what that means is that some people got the vaccine and some people got a placebo, so a dummy vaccine. And what that showed very clearly was that the people who were given the vaccine, which was an mRNA vaccine, did better. And they did better in terms of not getting infection at all and admissions. So in one of the studies, there were 10 people in that placebo arm who were admitted with serious complications of COVID, and only one person in the vaccine arm who was admitted with serious complications. And all that doesn't sound a lot. When you multiply that up, it becomes huge. And that's the case. There was a very significant reduction in terms of admissions. And the study was done in the same way as we would do any placebo-controlled trial, in a very safe way. We reported all side effects, all serious events, which means people getting admitted to hospital or death and so on after having the vaccine or the placebo. And what that showed was that it was safe. There was no there was nothing that showed that the vaccine was unsafe. And that's why it got rolled out. And in terms of that quickness, the actual time that was given to look at the safety of the vaccine was the same as we would have done for a vaccine that is being developed over a longer period of time. The actual time, it was just that we could do it quicker. And then, as you say, what happens after? It's clearly important. Studies will pick up quite rare side effects, and they will pick up common painful arm and so on. And we saw that. I mean, any vaccine, it gives you some local side effects. And they're all self-limiting. But in terms of the longer-term safety, that was looked at very carefully as well, and people reported that any problems that people had after vaccine. Some of them were just things that would have happened anyway, and then some of them, it became clear that there was a potential issue. And so an example of that would be something we call pericarditis and myocarditis. We saw a slight increase in that when people were given the vaccine, in particularly young men. What we saw, though, is that they were self-limiting. People, very, very, very few people got admitted to hospital with those things. And actually, what we saw overall is that although that seemed to be being caused by the vaccine, there was an overall reduction in myocarditis and pericarditis. You might say, well, why would that be when the vaccine might be causing it? Yeah. And actually, it was stopping people from having COVID, and COVID caused myocarditis and pericarditis. And when you saw myocarditis and pericarditis in COVID, people died, and they were young people as well. So, the vaccine was actually overall preventing those complications. So it is complicated.
Yeah, I think it is. It is complicated, and I think again, obviously, when we take ourselves back into when we had the pandemic, people were seeing nightly on the news, Prime Minister announcing it, the Chief Medical Officer, but obviously it's not as much in the news now. But is COVID still a thing?
Yeah, so it is, and we're still at the moment getting people admitted with certainly with coronavirus. COVID as an entity in terms of causing the pneumonia that we were seeing is much less common. Mm-hmm. But what we are seeing is people getting coronavirus and COVID and being affected in a similar way to flu. So they're having to come in because it's making their underlying medical problems worse. They're feeling sick. Mm-hmm. They get fever. They can't cope at home, especially the elderly, of course. And then they're getting the secondary complications. So it's affecting people in a similar way, and it's still causing deaths in vulnerable people.
What I'd like to do now is just perhaps talk more widely about vaccines and viruses. But what is a virus, really simply, and how does it impact the body?
So virus itself comes from, I think it's the Greek, and it's noxious substance. So noxious substance is, obviously something you don't want to have. We're exposed to viruses all the time, and some of them are not too harmful, some of them are very harmful. They've been with us throughout our history, through evolution, throughout time, and they have different effects. Some are very, very mild. But if you take the polio virus, that really caused both death and significant morbidity, which is long-term disability. So if you look at 1950, around that time, there were about 6,000 people who developed paralysis because of polio in the UK. I mean, we'll talk about the vaccines later, but the vaccines helped to just stop that from happening. So it's not just that these viruses can cause death, and that can happen. Measles, causes death in a proportion of people who get it. And it can, but they can cause longer term complications, which are lifelong. Mm-hmm. So the polio, I'm still seeing people occasionally who have a withered arm that they cannot use, and they've lived with that all their lives. They've done great, but it's been a disability that they've carried with them.
And why do we need to be concerned as the public, our families, our children, our grandparents, about vaccine preventable disease?
Yeah, so I think all of the diseases we vaccinate against have issues. So we can take measles. Again, if we go back to around 1950, around 250 children died of measles that year, out of around 900,000, I think, who were infected. So you can see then that they're important, and I think one of the issues we have is that vaccines stop that from happening. So we forget how bad they were. If you go to your grandparents and say, do you know anyone who died of measles? A lot will know somebody who died or was affected, or a family that was affected. In my own family, I know that I had, that there is someone who died of measles in my family. So all of the vaccines are trying to protect against serious consequences. But it's how much they protect varies between the vaccines. So they are very important, and will come perhaps into the way they work, but they're trying to just develop your immune system so you don't get the infections in the first place, or it's not as severe, not as serious.
I think that's a really good point, because I can remember when I grew up that when I had the measles, mumps, rubella vaccine in school, and my parents were telling me about kind of their family that they knew that had contracted that. So kind of linked to what you were just saying there, how do they train the immune system to fight the disease?
Yeah. So there's a lot of different types of vaccine. I think that's the first thing to say. But overall, what they're doing is showing the immune system something about the virus that you might get affected by. And what that means is that the immune system then creates antibodies. And other aspects of the immune system can be developed that will then fight the virus when it actually affects you. And that can be, hugely effective. It can mean that you can never get infected by that virus ever again. Measles is a great example of that. And it may be like the influenza vaccine that you need to repeat it each year. And there are different types of vaccines. So there are types of vaccines where you have the whole of the virus and you inactivate it maybe through heat, and that then shows your immune system the whole virus. And then there are other ones where a part of the virus is shown to your immune system. So a sort of subunit is injected into you, and that's often part of the virus that actually attaches to cells to get into the cell, that then your body then gets antibodies against that part of the virus to stop it from entering into your cells. I guess more recently, very importantly, we have live viruses, and they've been attenuated. They've been made less dangerous. Measles is an example of that. And so although they are still live as such, they can't cause infection, but you develop immunity against the actual virus when it comes through. There are new vaccines being developed. So the mRNA is a very good example of that. And what that is we all, in all of our cells, we have mRNA. It's a protein. Oh, it's not a protein. It's mRNA. It's from DNA, makes mRNA that then acts as a template for proteins. And actually that's hugely important for our functioning of our cells naturally. Viruses have mRNA as well. And some viruses are composed of mRNA, some are just DNA and make mRNA. But what a virus is doing is making proteins from mRNA that then, mean that the virus can replicate. And what we can do now is use that mRNA of the virus to make some proteins, and that does exactly what the other vaccines do, is show the immune system the protein that we want the immune system to attack. So it's quite complicated, but actually it's very ingenious. And that mRNA only exists in the body for a short period of time. Your cellular mRNA, the mRNA in your cells gets degraded, it disappears after a few certainly a few days, and this is what happens with the vaccine as well. So it's very exciting technology. I think the two other things I would say about that, the one huge benefit of mRNA vaccines is they can be changed very quickly. So if we get another pandemic, we can create new mRNA vaccine very, very quickly. So that's very beneficial. And it's also potentially a bit cheaper to produce some of the mRNA vaccines as well. And then actually, thirdly, that technology is being developed to develop vaccines against cancers and to treat cancers.
Yes.
So it's going to be really exciting actually into the future.
And I think you've very effectively summarised actually something that perhaps creates confusion in the public, in that, well, hang on, I get a vaccine for measles, that protects me through my entire life. But then my flu vaccine, actually, no, I need to have that every year because it changes. And then like COVID, we're responding to that latest change in the virus as well.
That's right. So, viruses like measles, hepatitis don't change much through, and therefore vaccines created against them generally last a lifetime. Yeah.
So I think just then unpacking, talking about the technology that you've just been speaking about with respect to mRNA, and we've spoken about the safety of vaccines and how they're tested, but people might hear in the news things like the MHRA or the Joint Committee for Vaccination and Immunisations. What's their part in providing that clinical assurance of the safety of these drugs?
So I'll take the last one you mentioned first. So the JCVI, the Joint Committee on Vaccination and Immunisation, that is an advisory body, and it's composed of scientists and who can look at the data that is provided to them, and that data comes from all sorts of places. It comes from industry, it comes from public health information, and they can then say what vaccines are required, and they can actually make some recommendations about developments that are needed. But actually, in terms of vaccines that are available, they will look at the evidence and decide and recommend when the vaccine should be given and to whom. So they're really in charge of giving advice about the vaccine schedules, especially in children at all ages. And they produce something called the Green Book, which then is the advice. And that advice is then looked at by governments and other agencies within government and then implemented. The MHRA is really a regulatory body, so they look at quality and safety across the board of all drugs and other healthcare products as well. But their role in vaccines, if a new vaccine is being developed, they'll look at any protocols around the research that is being done and say that that's fit for purpose to develop the vaccine into clinical use. Or not, and then they also will, once the vaccine has been agreed that it can be used, and they will be the body that will recommend that it is used. They will then ensure safety of the vaccine, ensure quality of the vaccine, ensure also that the production is such that we can get the vaccine in the UK. So they're very important in that regulatory side.
I think that's really important. It's particularly understanding what the Joint Committee for Vaccination and Immunisation does, because actually over time, over years for COVID, the eligible cohorts and people that has changed over time. But that's a good thing because it shows the effectiveness of the immunisation programme.
Yeah, the committee is working and looking at the evidence as it's coming out, and that a lot of those changes are because of public health information that's come through, or information collected by, for example, the UKHSA and other bodies and around the world to say, actually, it's less of a problem in this group, it's more of a problem in this group, and we should be vaccinating. And also looking at the vaccination data and how effective it is, and giving advice that it's less effective now in certain groups.
Vaccinations, we get them at different stages during our life. So when women are pregnant, early childhood, teenager, and then kind of age-specific vaccines. But why are they important during pregnancy and certainly in those early years for babies?
It comes into the same answer really. In terms of pregnancy, the mother is actually giving antibodies to her infant when it's in the womb. And when the baby's born, for a little while, it's protected from viruses and other things because of antibodies that have been transmitted. And certainly if the mother continues to breastfeed, some antibodies are given that way. But the baby's immune system is developing. It has no natural immunity. It has never been exposed to any of the viruses that it may be exposed to. And in addition, it's weaker. It's not as strong as when you've grown up and so on. And if it's affected by a virus that might be harmful to it, then it can be really harmful. And in addition, when you're pregnant, if you get a virus that can affect the baby in utero, then that is a bad thing as well. And it's particularly important for the MMR vaccine that people are vaccinated against that before they become pregnant, because if they catch those viruses in pregnancy, it can be harmful both mother and baby. There are 3 vaccines that are now recommended during pregnancy. And one of them is the whooping cough vaccines that protects against actually it's a bacteria called Bordetella, and that when a newborn baby gets that, or a young child, it can cause whoop. I had that when I was a child. My mum said I was coughing for weeks and maybe months, and in a lot of people it's fine, but in a small proportion of children, it can cause low oxygen levels, which can lead to brain damage, and it can cause death as well, and severe pneumonia and ongoing problems with the lung. So it's important to try and protect against that, and one of the ways to do that is to vaccinate the mother, and those antibodies will be transmitted across to the baby, because unfortunately the baby may get that from their older siblings and school mates and this kind of thing. And also the mother's protected then as well for when she's looking after the baby as well. The other one is RSV. The whooping cough has around a 70% effectiveness in terms of infection. And then RSV, I think a lot of people don't hear about RSV much. I think a lot of people have heard about whooping cough, but RSV is respiratory syncytial virus. And I think we know well for years that in children this is a really dangerous virus. It causes a bronchiolitis, and a lot of children every year are admitted to hospital, tens of thousands in the UK alone. And in the 20s to 30s may die every year from RSV, and that's a shocking statistic actually, isn't it? And it also affects the elderly as well. And I think, for a long time in my career, we always thought influenza was the bad thing, but actually RSV is just as bad as influenza, and studies have shown that around 4,000 people die from RSV in the elderly, so it's advised in them as well. But anyway, in pregnant women, if you vaccinate around 28 weeks, you can prevent again infection, but also you get those antibodies transmitted to the baby. And additionally, babies or young children are now being vaccinated against RSV as well. And then lastly, influenza. That can be a really nasty infection in women, and every year we get women being admitted in the latter stages of pregnancy just because their immune system drops later in pregnancy, and that can mean that they're more susceptible to viruses causing more severe infection.
It's fascinating listening to you, and obviously you're a specialist in infectious diseases. But if you're, say, that pregnant mother or the grandparent that's over 75 and is eligible for RSV, who are they best speaking to kind of understand whether the vaccine, they should get the vaccine, what's involved in the process for it?
Yeah, so I think the GP is always a good resource, and the practice nurses within the GPs often have a good source of knowledge as well. So I think first off, there's a lot of online from the Department of Health information, some really useful information leaflets that are online that can be printed off as well for your elderly relative to you can read them. Those information, it really clearly sets out the benefits and also some of the risks as well of any vaccine as well, but the overall benefits. in terms of the pregnant women, that they often will be offered the vaccines that they need through pregnancy, but the people to speak to will be the midwives and the people looking after them antenatally. Yeah.
And I know we've had a discussion about childhood immunisations and the Joint Committee for Vaccinations and Immunisations, and we've been made aware that there's going to be changes to the childhood immunisation schedule, and people may question that. But I think, what would be your view in terms of why that's happened?
Yeah, so I think one of the big things is that the MMR vaccine is being brought forward earlier, so it's going to be given at 18 months now. So the evidence of giving it at a younger age, it's not harmful to that age group at 18 months. And I think we are seeing lower rates of uptake. I mean, the majority of people are still taking up the MMR vaccine, but some people aren't. And I think that there's some evidence, or definite evidence, that bringing it forward earlier will help to protect children at a younger age, and also improve, that vaccination of children, make it more available as well, actually. And there's more opportunity for people to come forward for vaccination when it's brought forward.
And I know you and I are passionate about vaccines and their importance, but I think there will be members of the public who perhaps are concerned about vaccinations. But one of the real success stories that we've had in recent months is that for teenagers and having the HPV vaccine, that could eradicate cervical cancer in 2050. I mean, that's just incredible.
It's absolutely enormous. And there's recent Scottish data to show that people who were vaccinated, women who were vaccinated around the age of 12, 13 years old, they haven't found any cervical cancer in that group. Yeah, maybe that later we may find some, but it's reduced it to such a low level. And I think overall, in people who are vaccinated, if you look across everything, and this is bearing in mind that the vaccine that was first introduced wasn't quite as effective as the vaccine we've now got that was introduced in 2021. It was first introduced in 2008 and didn't cover quite as many of the cancer-forming virus, which is the human papilloma virus. And actually, the data is looking even better for the newer vaccine. But overall, if we look at everybody who was vaccinated, you see around a 90% reduction in cervical cancer in those who were vaccinated versus those who didn't get vaccinated. So it's a massive difference, that really is. Yeah, and it's
incredible.
It's a devastating cancer as well in women, and I think it can be, by the time it's found, it's too late and it's already spread, and the treatment is difficult.
And I just want to say thank you, because I know your time is precious and you will be shortly going back onto the ward. But just want to thank you for your time to have this discussion really today. One final thing, I think I already know the answer, but will you be having your flu vaccine this winter?
Absolutely, I will indeed. We have a very good system in our hospital, and I'll probably be approached before I even go and try and find it, and I will have it, yeah.
Thank you, Ashley.